Hello, welcome to Anatomy DAHAR series. Today's topic is muscles of mastication, illustrated, prepared and presented by Dr. Abdul Hamid, Abdul Rashid. Basic embryology. The first pharyngeal arch consists of two portions, the dorsal portion, the maxillary process, and the ventral portion, the mandibular process. This is right lateral view of the embryo. This is first pharyngeal arch. This is the dorsal portions, maxillary process, and this is ventral portions, the mandibular process. Mesoderm is the middle of the three embryonic layers. Mesenchyme is the embryonic connective tissue in the mesoderm. In a further development of the mesenchyme of the first arch, some of the components ossify to become bones, some form muscle tissues, and others become ligamentous or disappear. This is the right lateral view of the embryo. This is maxillary process and this is mandibular process. The maxillary process, the mesenchyme of the maxillary process gives rise to premaxillar, maxillar, zygomatic bone and part of the temporal bone through membranous ossification. Premaxillar, maxillar, zygomatic bone and part of the temporal bone formed through membranous ossification. All are bones of the upper jaw. The mandibular process, this is the one which is more important. The mandibular process contains number 1, Meckel's cartilage, which is wrapped around by the covering, that is perichondral membrane of the cartilage, and they are surrounded by number 3, mesenchyme, that is the connective tissue of the mesoderm of the mandibular process. Look at the diagram. Mandibular process of the first arch. This is the mandibular process of the first arch. This is the second arch. During further development of the mandibular process, Meckel's cartilage disappears, except for its dorsal end that forms two ossicles of the middle ear, that is malleus and incus. The perichondral around the Meckel's cartilage becomes ligamentous, that is sphenomandibular ligament. So from where does the mandible develop? The mandible does not develop from the Meckel's cartilage because it has been disappeared. The mandible is developed from the mesenchyme around the Meckel's cartilage by membranous ossification. The musculature of the first pharyngeal arch developed from the mesenchyme. They include principal muscles and accessory muscles. The principal muscles of mastication are temporalis, masseter, medial and lateral pterygoid muscles. Accessory muscles of mastication are the anterior belly of digastric and mylohyoid muscles. Innervation. The nerve of the first pharyngeal arch is the mandibular nerve, that is third division of the trigeminal nerve, V3. Therefore, all the muscles of mastication are supplied by branches of the mandibular nerve. Characteristic features of the mastication muscles. All the muscles of mastication are developed from the mesenchyme of the first pharyngeal arch. All are attached proximally to the bones of the skull and inserted to the mandible, which develop from the mesenchyme of the mandibular process. All are supplied by the nerve of the first pharyngeal arch, the mandibular nerve, that is third division of the trigeminal nerve. All are concerned with movements of the mandible on the TM joint, temporomandibular joint, mainly for mastication. The skull. This is the diagram of the skull seen from right side, right norma lateralis. This is in front, anterior. Let's see the bones in this diagram. F, frontal bone, P, parietal bone, O, occipital bone, T, temporal bone, Z, zygomatic bone, MX, maxillary bone, and MN, mandible. This is coronoid process of the mandible, and this is ramus of the mandible. If you see from the lateral side, on the side of the skull, you will see two thin curved lines here, the upper and lower. The upper one is called superior temporal line, and the lower one is called inferior temporal line. Space between the superior temporal line and the zygomatic arch is shallow and called temporal fossa. Temporal fascia. Let's see the diagram first. This is the coronal section, and we are showing right half looking from behind. Coronal section of the right half of the skull, we are looking from behind. This is right side. This is medial side. Now let's talk about temporal fascia. Let's identify the structures first. This is superior temporal line. This is inferior temporal line, and this is infratemporal crest. This is coronoid process, and this is ramus of the mandible. This is zygomatic arch. This is upper border. It has lateral margins and medial margins of the upper border. Let's talk about the temporal fascia. It's a thick fibrous layer attached above to the superior temporal line, and it comes down and split into two layers, lateral layer and medial layer. They are attached to the respective margins of the upper border of the zygomatic arch. The space between the two layers is filled with fat, contains blood vessels and the nerve. Temporalis muscle, T. This is temporalis muscle, T. Let's see the diagram first. As we know, this is right half of the skull looking from behind, posterior view. The structures here are, you can see here, this is inferior temporal line, and this is temporal fascia, this is zygomatic arch, this is infratemporal crest, and this is coronoid process. This is the medial surface, is the temporal fossa between the inferior temporal line and inferior temporal crest. We have already mentioned about this one. So let's talk about the attachment of the temporalis muscle. Above, the temporalis muscle fibers come from two sides, medial and lateral side. On the medial side, the muscle fibers are coming from the temporal fossa, that is between the infratemporal line and infratemporal crest. But on the lateral side, the temporalis muscle fibers are coming from the deep surface of the temporal fascia. Temporalis muscle continuation. Let's see the diagram first. This is temporalis muscle. This is zygomatic arch. This is coronoid process of the mandible. You can see dotted line because it is deep to the zygomatic arch. This is apex of the coronoid process. This is anterior margin of the coronoid process. If you continue down, it will be the anterior margins of the ramus of the mandible. And finally, this is the third molar tooth. So, the temporalis muscle is a fan-shaped muscle. Look at the fibers there. Inferiorly, the fibers of the temporalis muscles converge to form a thick tendon here. It is coming down deep to the zygomatic arch, and it is attached to the medial surface of the coronoid process, apex, anterior margins of the coronoid process, and along the anterior margins of the ramus of the mandible until to the third molar tooth. Temporalis fibers. Look at the upper picture first. Most of its anterior fibers are vertical. Most of the posterior fibers are horizontal, and intermediate fibers are obliquely oriented. Nerve supply of the temporalis muscle. The deep temporal branch of the anterior division of the mandibular nerve, that is third V3 trigeminal nerve. The action of the temporalis muscle is, number one, its anterior, that is vertical fibers elevate the mandible and close the mouth. Anterior fibers will elevate and close the mouth. The posterior horizontal fibers retract the mandible after it has been protruded. Retract it after it has been protruded. Masseter muscles. Look at the diagram. This is the right lateral view of the skull. This is zygomatic bones, and this is zygomatic arch. This is ramus of the mandible. Let's talk about the masseter muscle. Look here, it is quadrangular shaped muscles, thick and broad. It is originated from the maxillary process of the zygomatic bone and along the inferior border of the zygomatic arch. It is inserted into almost the whole of the lateral surface of the mandibular ramus. Most of its fibers slope downwards and backwards about 45 degrees. The posterior fibers descend vertically. Nerve supply of the masseter. It receives branch from the anterior divisions of the mandibular nerve. Artery. Branches of facial, maxillary and superficial temporal arteries anastomose on its surface and within the muscle. Action. Look at the muscles here, masseter muscle. The masseter muscle elevates the mandible to close the mouth. Its deep fibers together with the temporalis muscle retract the mandible behind. Pterygoid plates of the sphenoid bone. This is a diagram of the sphenoid bones, posterior view. You are looking from behind. This is the body of the sphenoid. This is lesser wings of the sphenoid. This is greater wings of the sphenoid. This is the junction between the body and greater wing of the sphenoid, and this is inferior part of the junction. From the inferior surface of the junction between the body and the greater wing of the sphenoid, the pterygoid process projects downwards. This is pterygoid process, projects downwards. Each consists of two plates, medial pterygoid plate and lateral pterygoid plate. The lateral pterygoid plate has two surfaces, lateral surface and medial surface. The lateral surface is attached by major part of the lateral pterygoid muscle, and its medial surface is attached by major part of the medial pterygoid muscles. Therefore, lateral pterygoid plate is attached by laterally, lateral pterygoid, medially, medial pterygoid. So this plate is also called muscular plate. Lateral pterygoid muscle, we have two diagrams here. This is left lateral view showing the left TM joint and left ramus of the mandible. This is posterior view but also showing left side of the TM joint here. You are looking from behind here. Lateral pterygoid muscles. This is the lateral pterygoid muscles looking from the left side. This is the lateral pterygoid muscles looking from behind. Lateral pterygoid muscles consist of two heads, upper head and lower head. Upper head and lower head. The upper head, UH, arises from the roof of the infratemporal fossa and crest of the crater wing of the sphenoid bone. The lower head is the major part, big part. It arises from the lateral surface of the lateral pterygoid plate. Just now we have already mentioned. Lateral pterygoid muscles. This is the diagram, left lateral view. This is left TM joint and this is left ramus of the mandible. This is left lateral pterygoid muscles. Pterygoid muscles has two heads. We know that, upper head and lower head. They fuse into a short and thick tendon which is inserted into pterygoid foveae, which means pit or depression on the front of the mandibular neck, the condyle. The upper fibers of the tendon pass through the anterior part of the capsule and are attached to the intra-articular disc of the TM joint. Nerve supply. They receive anterior division of the mandibular nerve, that is the third division of the trigeminal nerve. Actions of the lateral pterygoid muscles, we have two diagrams here. Lateral pterygoid muscles opens the mouth, draws the neck, that is condyle of the mandible, and the disc forward. It is assisted by suprahyoid and infrahyoid group of muscles. Together with the medial pterygoid muscles, this is the medial pterygoid muscles, lateral pterygoid and medial pterygoid muscles protrude the mandible forward. Alternate with medial pterygoid muscles moves the mandible side to side in chewing movements. Medial pterygoid muscles. This is the diagram of the posterior view of the right half of sphenoid bone and mandible bone. This is ramus of the mandible. This is medial surface. This is mylohyoid groove of the mandible. This is lateral pterygoid plate, medial surface. Medial pterygoid muscles is a quadrangular shaped muscle consists of two heads, superficial and deep head. This is superficial head and this is deep head. Superficial head is smaller and arises from the maxillary tuberosity and lateral surface of the pyramidal process of the palatine bone. Deep head is the major part, arises from the medial surface of the lateral pterygoid plate. We have already mentioned that one. This muscles inserted to the rough area on the medial surface and angle of the ramus of the mandible, as high as the mandibular foramen above here, as forward as the mylohyoid group around here. Medial pterygoid muscles continuation. Look at the diagram again. This is left lateral view. This is medial pterygoid muscles. It has deep head and superficial head. This is lateral pterygoid muscles, upper head and lower head. Look at the diagram again. The superficial head and deep head of the medial pterygoid muscles embrace the lower edge of the lateral pterygoid muscles. You can see here superficial head and deep head of medial pterygoid muscle embrace the lower edge of the lateral pterygoid muscles. Medial pterygoid muscle fibers pass downward and backward at the degree of about 45. Nerve supply of the medial pterygoid muscle. It is innervated by nerve to medial pterygoid muscle, which comes from the main trunk of the mandibular nerve. All other principal muscles of mastication receive nerve supply from the anterior branch of the mandibular nerve. The accessory muscles of mastications are supplied by the posterior branch of the mandibular nerve. Actions of medial pterygoid muscle. Look at this diagram here. This is medial pterygoid muscles. When this muscle contracts, it closes the mouth by pulling the angle of the mandible upwards, forwards and medially, and closes the mouth. Alternately, it moves the mandible side to side in chewing movements. See figure A. This is right temporomandibular joint. This is the head of the mandible. This is left temporomandibular joint. This is the head of the mandible. Medial pterygoid muscles is attached to the medial surface of the ramus of the mandible. When it contracts, it pulls this right temporomandibular joint, which will glide forward. The mandible will be tilted to the left side, and left temporomandibular joint, here is the axis, will rotate. So this joint will rotate and call working side, WS, and this joint is not rotating. This is called non-working side. The end. Illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.